This is Late Night Health. This is the radio show that cares about the most important part of your life, your health. Hi, I'm Mark Alyn. During the next 2 hours, we're going to talk about a wide variety of health topics that touch each and every one of us. We're going to get an update on the Zika virus. We're going to talk about grief, and we're going to talk about storytelling. All of that as it relates to our health. Of course, joining me as always is the insane Daryl Wayne.
Present and accounted for, sir.
Hey, oh boy. We're getting military in our old age, are we?
Have you ever heard military alignment?
No.
Okay.
All right, we'll have to worry about that. Continue. We're going to start with talking about an organization that I've been working with because I think it's just such a great idea. It's called Join Our Story. The co-founders are here. Adam Simon and Celeste Davidson are here. And we're going to find out what Join Our Story is. They actually were a guest a year and a half ago, I think, for a little bit.
I think so.
They're in studio with us now. We'll start with Adam. What is Join Our Story all about, Adam?
Join Our Story is a web platform, so it's on the internet, where people can go 24/7, any time of the day or night, and tell stories. Right.
And storytelling is really an important part of our lives, isn't it?
Exactly.
I mean, in fact, my title is storyteller. Mm-hmm. That's what I've called myself that for years and years. And yes, Daryl is about to say, boy, do you tell stories.
Hans Christian Andersen, you're not.
Oh, okay. Hans Christian, never mind.
Stories are very important to us. In fact, stories are what makes us human, and stories give our lives meaning, and stories allow us to express ourselves to our friends and to others.
And one of the things that we're going to talk about today is that Join Our Story has an offer that we're going to make available. It's free, and it's a class that's taught by Celeste in telling stories, how to write your story. Let's talk about seniors, though, and this is designed primarily for seniors, though it's an intergenerational application, if you will, and that is that a lot of seniors, maybe somebody who's 60, 70, even 80 or 90, their spouse dies, their partner dies, they're left alone, and they end up watching Wheel of Fortune every night. That's the highlight of their life. That's the engagement in life. Join Our Story is more than just a class. It's a community.
That's absolutely right. First and foremost, it's a community, a place that people can go to socialize. And the storytelling, although it is the essential core of Join Our Story, obviously, is something that people can rally around. So they can create stories and share them with other people. They can discuss the stories of their lives and the stories that they wish they had, and create new chapters in their lives.
I should point out that both Adam and Celeste are professors. Adam has a doctorate. Celeste is working on her PhD. But you have taught Celeste writing.
Yes, I have taught writing.
Right, and you're a published author.
Yes.
Right. Why is writing so important? Why is storytelling so important? Adam said a few minutes ago that telling stories is what makes us human. Do we all have stories?
Well, we all have stories. And stories actually are the way that we make meaning, make sense of our world. And it's been this way since the beginning of the human, beginning of time. If you look at cave drawings from thousands of years ago, the stories are being told of the hunt. I know this is going way back, but everyone tries to make meaning of their lives through story. And even if you don't think that you're a storyteller, you're doing it all the time. And I think a lot of people don't understand that they already have that ability. They already are telling stories, and all we want to do is provide a platform for people so they can share their stories, and if they want to improve their ability to tell a story, then we can help them with that as well.
We'll have at latenighthealth.com a link, if you will, to joinourstory.com. Joinourstory.com. You can participate in this. It's really going to be exciting because what Adam and Celeste have put together with a whole team of people is a unique way of reaching out and touching others. And that's really what we want to do. Not in that way, Daryl.
I didn't say anything along that line.
No.
But,
although you may meet some interesting people.
Yeah. I love the concept. In the business that we're in, Mark and I radio, things have sort of boiled down to just sort of back announcing what song you've heard, time, temperature, blah, 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 blah. But we used to be storytellers.
Yeah.
And the thing that I've always told people is, it's always nice to have a beginning, a middle, and an end, and you should know where the end is when you start so you know when to get out.
Right. And which is absolutely true. And that brings me to, I guess, the formatting of a story. I tell a story differently than Daryl, differently than Adam or you, Celeste. When I'm speaking, I tell stories differently. I direct people to tell stories differently when I'm working with others, not only to make it compact, but to make it more engaging, because that's the key. And I think that telling stories and reading stories, I read every night before I go to bed. Every night I read stories. Most of them are junk. They're not literature, but they're fun, and it relaxes me. I don't have to worry about the day of guests not showing up and, all that kind of thing. What about that? Can anybody tell a story?
Yeah, let me say first, Mark, I think you said the key word, which is fun. Right, this is all about fun, and not to make it too simplistic, but fun makes you happy. Right, that's it.
Which would also make you healthier.
Exactly.
Happy people tend to be healthier.
There you go.
Mm-hmm.
Right. So instead of sitting at home worrying about your blood pressure, if you were sitting at home writing, or talking, or texting, we'll be able. You should be a happier person because you're involved. One of the applications of Join Our Story is that you've been doing some testing live, if you will, at facilities throughout Southern California. How's that going, and will that expand?
It's going great. So there's two thoughts here. The first is sharing your stories, having fun creating your stories, and enjoying other people's stories are what it's all about. I won't call it a problem, but the challenge is, how do you reach people who have difficulties leaving their houses, who just may not have time in the middle of the day, who want to do things at night? And so the idea is we're going to use technology, right? Everyone has a cell phone these days. Computers are more powerful than ever, and we're all connected, right? But what people lack is a place to go to with that connection where they can meet people who they share things in common with, have the same enthusiasms, who are interested in each other, and then can relate to each other and have fun.
One of the things that I like about Join Our Story is the engagement with people. Because a lot of people sit, as I said, and don't communicate. A lot of people also are computer afeared.
Oh, absolutely.
Right? And especially those over 50, 60, yet they are the fastest adopters of social media.
That's absolutely true.
Well, I go back to my grandparents. My grandfather was a great storyteller. My grandmother knew everything about the history of the family. And when they passed away, a lot of that is lost.
Yeah.
It's gone. You don't have the folklore. You don't have the mythology. You don't have the setup or the I'm going to call it intuition that they put into these stories.
It's a great loss, too.
Yeah, it's huge,
loss.
Huge. We go to family events now, and my grandmother knew when everybody was born, where they were buried, we've sort of lost some of that.
What about, in talking with that, what about recipes?
Well, can I give you one example, Mark, about what Daryl was saying?
Yeah, sure.
So we've been working a lot on this, we'll call it a program, but on this Join Our Story in live situations where people can get together and sit in the same room. And what we're doing is we're transferring that into an online situation so people can take part no matter where they are. And if you think about those live situations, one of the weird things is that everyone writes things on a notebook. And what they can do now is write things on the computer or online, and that means they're going to be saved forever.
And what we're going to do is we're going to continue our conversation about Join Our Story. Coming up in about 15 to 20 minutes, we'll talk about grief. We're going to be talking with the author of a new book. It isn't even out yet. It's called Dancing at the Crossroads. Melanie Paintner will be joining us. We'll also hear, of course, from Robert Clancy, and we'll talk about fear as we wrap up today's show, and that'll be coming up in hour 2. All right, lots more coming up. Join us at latenighthealth.com, latenighthealth.com. We will be back.
You're listening to Late Night Health with Mark Alyn. The show continues in a moment.
If you or someone you love suffers from drug addiction, now is the time to utilize your private health insurance PPO plan. If eligible, receive up to $30,000 or more in substance abuse benefits with low or no out-of-pocket cost. We are the National Treatment Network, the premier drug and alcohol treatment referral service operating 24/7. We help connect you with facilities nationwide that accepts PPO private health insurance for substance abuse. If you have PPO substance abuse coverage and you need immediate admittance to a medical detox or residential rehab treatment center, call us now. Call our live referral helpline today. The call is free. This program is not available to Medicare or Medicaid customers.
Call 800-296-1252. 800-296-1252. 800-296-1252. That's 800-296-1252.
Are you being audited and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate a lower tax bill. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will fight for you using industry secrets that can stop any IRS actions, eliminate penalties and interest, and reduce your past tax bill so you pay the IRS less. If you owe $10,000 or more in back taxes, call the Tax Doctor now for a free IRS audit emergency review.
800-663-5107. 800-663-5107. 800-663-5107. That's 800-663-5107.